Hi. Hi, everyone. Welcome. It's Naomi Wolf with Daily Clout, and I'm so excited to have Dr. Jennifer Svahn talking to us this morning. Welcome, Dr. Svahn.
Good morning. Thank you.
I'm so excited to have you here. For those of you who don't know Dr. Svahn, she's a 23-year board-certified vascular surgeon. She's married to another surgeon, a lot of surgeons in the family, and she has two college-age sons, both of whom are not on campus due to the pandemic. And I reached out to Dr. Svahn with her tremendous medical background and her being part of a medical family, because as you know, we're doing a series of smart moms who have, opinions about what's going on with our kids and with the pandemic. So go ahead, Dr. Svahn, and just tell me a little bit about, your current family situation and what some of your thoughts are.
So, good morning, and thank you, by the way. I'm happy to be here talking. As you mentioned, I'm a vascular surgeon. I've been in practice for 23 years. I am currently still practicing and seeing patients in Manhattan. I have two boys, a second-year college student and a first-year college student, who have probably been impacted the most, actually. My husband is also a surgeon involved with caring for patients with COVID. Both of my boys have had some significant changes with their college experience. One has actually taken the year off and is doing other significant work to fill his time and lead a productive year. And then my younger son, who's a first-year college student, is enrolled and is taking classes, but has yet to be on campus. So he's doing remote Zoom work from home. In terms of my professional experiences, I was actually out of work, not able to see patients for about 2.5 months. I was able to get back in and have been seeing patients in the office again since the beginning of June 2020. My husband has not been out of work at all because he's sort of leading some significant efforts in terms of dealing with the COVID pandemic with his healthcare system.
Right. So you're seeing this pandemic and the effect on young people from many different levels, professional, your husband's professional vantage point and your son's vantage point. I guess my first question to you is, as and again, I'm speaking as the mother of a son your son's age, one of your son's ages. Do you think it's safe for students to have in-person learning, or how do you feel about the fact that these young men who are so ready to have normal college experiences? I mean, obviously I'm betraying my bias a little bit, but, do they have to be on Zoom? I mean, from what I've understood talking to other distinguished doctors and medical professionals, young, healthy people in their 20s are at very little risk from this disease. So what are your thoughts about having, healthy young men on Zoom and missing out on their college years?
So, I ask myself that question almost on the daily. How do I feel about that? And to be very honest and transparent, my answers fluctuate depending on which primary hat I'm wearing. Am I wearing my scientist hat, or am I wearing my mom hat? And the fact is that my bias may change depending on which hat I have on. So, I mean, it's created a lot of conflict for me. I do strive personally to find that middle ground, the Venn diagram where the overlap happens.
Right.
It's been tremendously disruptive for my own kids' experience. That said, I would applaud them and every other young person out there who's managed to make it still a meaningful time in their lives, albeit absolutely changed and derailed from what they were expecting. So when I have my doctor hat on, I think while students, healthy students in the usual college age group, are far less likely to have significant morbidity and mortality if they are infected or actually have the disease. I do think, though, that we live in a society, we live in a world where we don't live in a vacuum.
Right.
And I do expect globally that my kids live their lives in a way that shows respect and consideration for also the people around them.
Right.
That said, it's actually hard to put words to how I feel about this, because I've seen my own kids sort of railing against the situation and still, though, going out in the world with some deference to how the people around them might feel.
Absolutely.
So I think in general, that's sort of a good way to conduct our lives.
Right.
It's not just a me situation, but there does need to be some me in it. That's how we all live.
Right.
So I think, I don't even know if I'm answering your question well, and I think that reflects how conflicted I sort of am. I haven't kept my kids locked in an attic,
Right.
although my kid is essentially in the attic because that's where he's doing college. But I've given them the respect that you live your lives and make your choices, and I do hope that in making those choices, you're also considering the people around you.
Right.
So do I want you locked up in a stone castle? No. Do I expect that when you're out in the world in private enterprise that you, like we all do all the time in other things, you abide by the laws that they've set up? And if you're not comfortable with that, then just don't do it.
Right.
As opposed to being antagonistic.
Gotcha. So that really makes sense. And I really just want to applaud you for being transparent about the nature of being a mom and a professional, or a parent and a professional. There is a storm of conflicting feelings, depending on what the news says or depending on what studies one reads. I'm not a scientist, and my view of how young people should live, or how I should live, and how schools and universities should conduct themselves changes every time I read a peer-reviewed study that is often being misrepresented, in my view, by the news media. So let me restate what I've heard you say. I just want to say, I know one of your sons. He's a wonderful young man, super respectful to other people, and definitely making, the best use of this difficult time. But what you just described about making one's own well-informed personal choices, but also respecting others, that used to be called common sense and decency. And I would have thought our young men and young women would be raised so that if they had pneumonia, they would stay at home and not breathe on immunocompromised people, or any other kind of respect for other people that shouldn't, in my view, be mandated in a one-size-fits-all way, and I don't believe that's part of public health plans in the past. So let me ask you this a little bit differently. If you could wave a magic wand and get the very expensive universities that all of our kids go to, I'm not going to name names, to conduct business in that Venn diagram way, according to your best wisdom as a scientist and medical professional, and your best emotional knowledge as a mother, what would that look like? Would they all be on Zoom? I've been asking this question a lot, especially of the Great Barrington Declaration doctors, because it seems like we know now that there's some shades of gray that would suggest things like, well, let older and immunocompromised teachers who want to stay home and teach virtually do so, but there really isn't a risk to having a big outdoor classroom for college students, or a well-ventilated space with distance for college students. So what would it look like day to day for your college-age sons to be students right now?
Yeah, so I would like to see a little bit more opening up and leniency well, I can only speak to the two schools I have experience right now. So those are the two schools my sons attend. But I would like to see, as we have a better understanding of the science, which of course is still in flux. This is still, after all, a novel experience. So we are all learning as we go along. So it's a very fluid situation. But as we see more and learn more, and of course, as the vaccine rolls out, because I certainly expect and understand that people want to protect themselves. But now as the vaccination rolls out, I would certainly like to see some more opening up and some more reasonable leniency and creativity in some of the schools.
Could you be
I don't think
that would look like practically, like my son, I'm not going to name names. I love a 21-year-old, unnamed 21-year-old who has to wear a mask alone outside, and he's asthmatic. And I'm a little worried about the long-term effects of this. And I also know from the aerosol studies that you don't protect anyone by wearing a mask 20 feet away from people outside, especially in young, healthy people. So what specifically would it?
So there needs to be a reasonable fact, as we know it right now today, based decision-making tree. So there's nothing in the science that we know, or as I understand it right now, that would say all alone outside 20 feet away from other people makes any sense that having a mask on is going to have any impact on that disease transmission. So I would like to see a reasonable application of the facts and science as we know it today. What would I like to see for my one son's college experience who has been on campus in the past? I'd like to see, particularly in the good weather months, I'd like to see some more outdoor classroom experience. I'd like to see the ways that we can make that happen and still respect the social distancing as we know it today. So can we place chairs 6, 7, 8 feet apart? Can we still have a teacher teaching in front of that group? Mm-hmm. Yes, we can do these things. We need to be creative and still respectful of the facts as we know them. Certainly there may be choices. Do the teachers not want to teach in person for whatever their own reasons are? And you don't need to justify your reasons to me, mm-hmm. nor do I justify my reasons to you. But if there are options available, and one of those options is to be teaching in person in front of your students on the campus when weather's permitting, which it will, spring, summer, and fall, even in the Northeast. Those are things that our students should be allowed to experience. I do think there are ways to be more creative and adaptive and still respectful of the science, mm-hmm. As we understand it today. And I'd like to see some of that rolling out more as spring rolls around.
Thank you.
Summer and fall.
Those are great recommendations. And let me ask you about mask wearing, if I may. I've read the studies. They're pretty, they're kind of a wash. I mean, there's not strong evidence that masks make a big difference. But, what I do want to ask you about is OSHA. Our kids and our young people, and I have a 9-year-old stepson. I'm quite worried about him. They're being asked to wear masks 6, 7, 8 hours a day. And for you as a surgeon, you wear PPE professionally. Is it standard OSHA law that you wear a mask 6 or 7, 8 hours a day as a surgeon, or are there limits to when you do, or what's the protocol around that?
So, outside of the pandemic experience, I've had days where I've worn a mask for 15 hours.
Wow.
Where I've worn a mask for 1 hour. It all depends on, obviously what we're doing at the time. Masks do prevent or do cut down on particle droplet transmission. It literally serves as a mechanical barrier. So there is, there is a functional role for mask wearing when we're in a situation where we are close enough that particle transmission can be anticipated. again, it's a reasonable application of science and common sense. What I'm more disturbed about are people who seem to be using, again, and this is my interpretation, but seem to be using this time and experience as a way of making sort of personal statements,
Right.
which are serving a whole different purpose for them. I don't buy the person who claims that wearing a mask for a brief period of time to go into a private store is really infringing on their experience of life. It's hard for me to buy that. I feel like it's sort of drawing an antagonistic line in the sand and just creating sort of an unnecessarily uncomfortable interface for everyone.
Yeah.
That disturbs me more because it just seems not nice.
I totally hear you. And again, I would have thought in a civilized society, people would make those choices to be respectful of each other. But I guess what I'm asking, totally agreeing with you about that, is do you think that there, and maybe you don't think there are, but do you think there's any kind of medical or psychological downside to a 9-year-old or a 20-year-old wearing a mask when there isn't an aerosol droplet reason to, 6 or 7 or 8 hours a day?
I can't speak to the psychological impact. I mean, I guess you could argue that being forced to do something out of your own choice box may have some psychological impact. I don't know if there are any studies on that, and I can't really speak to that. I don't think there's a medical downside to it.
I see.
Again, I don't know of a disease, including asthma, where wearing a mask impacts that. Otherwise, all of the asthmatic surgeons in the world would have had problems. I mean, I've been wearing a mask for the last 30 years.
Right. Good point. Okay. Well, let's move on to other things. What do you think? Do you think kids need to be on campus even in a pandemic as opposed to Zooming from their rooms?
Okay, so now I'm speaking as a mom, and I'm not at all speaking as someone with a background in psych or social circumstance. I'm just talking about as a mom observing my 2 boys. So it's an extremely personal experience. So let me just say that to start with. But yeah, I think even my one son, who's far more introverted, who initially was like, I would check in, hey, how you doing? How are you feeling about things? Are you doing okay? Who initially was like, yeah, you know what? I'm basically an introvert. I'm fine. Even he now, a year in, is like, I need to get back on campus because, number one, I'm missing out on that experience that I worked for so long. And on that level, deserves. Mm-hmm. Whatever deserves has, and I know that's a loaded word, but he's also concerned about his ability to start networking, making friends. Yeah. What does it mean for all the things he wants to do in his academic career? So he has some real concerns about that. And frankly, I share those concerns.
Right.
I have another son who who is extremely extroverted.
Yes.
Really struggled far earlier with that. So as a almost 21-year-old guy, who part of his strengths, or I think in his sort of ability to interface and interact with other people, and in leadership roles, in friend roles, in colleague roles, his sort of psych experience with it early on was far more negative because he missed out. Now, because he is who he is, he managed to deal with that in a productive way and say, look, I've got to make this a productive year for myself. So I need to find ways that I can still be productive, be engaged, be academic, and get through this year. So I applaud him for that, and I applaud every other kid who's...
Yes, but I will note, without naming names, but that he has managed to create a life in which he is out and about in ways that, Dr. Fauci might not...
He is out out.
Yeah.
When in a certain community, he's respectful of the rules of that community,
Totally.
though.
Totally. Absolutely.
And that sort of gets back to my initial point of, regardless of our own personal beliefs, I think if we all at a baseline subscribe to just a very minimum threshold of, look, I don't really buy into this, maybe someone's saying that, but I'm still going to, because I live in a society, I'm still going to abide by the very basic parameters that have been set down that aren't really impacting me. So he has done that, as have a lot of people. And
again,
never been,
right?
I'm
That's,
sorry.
I mean, again, that's common sense and decency, right?
Right, it is. And I think I think what some people rail against is a feeling that their ability to make their own choices, whether I think they're significant things or not, isn't relevant. But the idea that some of that autonomy has been taken away almost creates, it's that thing as a parent. If you tell your kid not to do it, they're going to do it. So if we're told we can't do X, Y, and Z, all of a sudden we're going to rail against that. When maybe deep down we don't really care. It's more about the restrictions. I think if people are left to their own devices and said, listen, go out, that thing in life, do what you think is the right thing. I'm not going to tell you what that is.
Right.
We're all, or a lot of us are adults. So now is that time where, what do you do when someone's not looking?
Right.
Right.
Exactly.
And most people will actually do the right thing.
And I saw that early on in the pandemic, before there were these legal mandates to behave in certain ways, people were very kind and considerate, overwhelmingly, but they were making their own decisions that were right for them while being respectful of others when they could not avoid distancing. So let me ask you this question. Other physicians I've spoken to have said that people are expert on their own health conditions and they're expert on the level of risk that they want to take. What do you think about all of these guidelines being guidelines rather, just kind of, I'm elucidating what you said. What do you think about that idea? And this is true in other pandemics, that we should be told what to do, like the HIV pandemic. We should be told what are best practices, but really, people should decide for themselves. As a physician, what do you think about that view?
Right. So with certain, I don't really believe that people understand their own disease as much as they sometimes think that they do. And frankly, why should they? They're not necessarily trained in the science of it.
Right.
Do I believe people have a essential sort of gestalt about themselves? Absolutely. Sure. You live in your body.
Yeah.
Yes, of course. And that's how I approach the care of my patients. That said, I think, again, understanding and respecting the fluid nature of things, which is why public health recommendations change over time. It's not because people are trying to hoodwink us or trick us, but in fact, it's a fluid, dynamic, and ever-evolving situation. So I'll take it on good faith, and I'm sure there's a point of contention here, but I do believe that the public health experts, just as I do when I interface with my patients, are trying to make the best recommendation based on what we understand right now at this moment in time. And that may I like very much living in a society and a country where at the end of the day, ultimately, at least in the public arena, I can make choices.
Right.
I have the freedom to make those choices. Now, that doesn't mean I have the freedom to make choices that then impinge on someone else's ability to live their life the way they want to.
Right.
And I think it becomes more of an issue when we're in private public spaces. So we may think of them as public spaces, but they're not really. They're private public spaces.
And that goes to your point of like entering a store and respecting the rules of the owner. I totally agree with you, but it sounds like, and I'm putting this in context with so many other decisions we make, whether it's smoking or drinking or being obese and not losing weight, we make a lot of decisions that are maybe not best for our mortality tables overall, or that have elevated levels of risk, that the government doesn't say, you know what, I'm going to take that cigarette out of your hands. This country has tried that with prohibition, and it didn't end well. So I really respect what you're saying. So basically, as a mom and as a citizen, what I'm hearing you say kind of makes very good sense and sounds like kind of the American way: common sense and decency informed by a scientific knowledge base, and caution, due caution, which is this is an evolving situation. We don't know all the science. There is a reason to be cautious. We should not breathe on each other, at close range for extended periods of time. But that our kids should be back on campus with due precautions. There should be outdoor learning opportunities and outdoor social opportunities, which I totally agree with, especially as the weather gets warmer. People should respect, stores that want them to wear masks when they go inside, but otherwise they should act with common sense, respect, and basic human decency. Are those good summaries as a mom and as a person?
That's a perfect. That's a perfect. Yes.
Is there anything else you want to add? Like, when do you think our boys and girls will be kind of free to live a normal life, and what should parents do to support our kids? Like, I really want to talk to the dean of my son's university and say, here are the studies. Get these kids outside. Take their masks off, for God's sake, when they're outside. Let them smile at each other. This is unreasonable to keep them so isolated. What can parents do?
Well, and this is happening at the two schools that I have experience with. The parents are, as a group, who of course have our kids' best interests at heart, including their health and the health of the college or university community, have joined forces as, a lot of smart, informed people, and are demanding to be heard and to be listened to and to have input. And I think the schools are well advised to allow parents and the students to have a seat at the table. So where the schools certainly have the health of their community at heart, maybe there's some other factors weighing in as well. So I think the more people that are allowed a seat at the table for productive, collaborative discussion, I think that just absolutely has to happen, because at the end of the day, while we don't have to go to those schools, we are currently at those schools, and we are spending tremendous amounts of money to be at those schools.
And our kids are very, very hard for their college experiences. Yes.
Exactly. And I expect to have the eye of parents. We expect to be heard and respected and listened to and have a seat at that discussion table. Now, understanding though that being in that community, the respect and the conversation goes both ways. But it can't just be a unilateral hand down the decrees type of situation. And I see that evolving, and I do see some change in that overall environment, where there is more of a listening bi-directionally happening right now.
With the goal of it's a safe but more normal college experience. Is that correct?
Absolutely. And I think, and this just speaks to sort of good leadership. I think the ability to listen, as opposed to dictate, is really one of the main hallmarks of good leadership. So it's a challenge to the schools.
That's wonderful. Well, that is a great note to end on. It's going to inspire parents of college-age students across the country. May I, before I sign off, throw out a thought? Maybe your group might consider, because you collectively have such a deep expertise and knowledge base among all of you. I'm sure there are other physicians as well. Might you consider putting together like a one-page fact sheet we would publish as a model with links to peer-reviewed studies about how other parents can bring to their deans and to their communities an example of safe reopening that lets kids have some semblance of a social life, some semblance of, extracurriculars, some semblance of outdoor safe learning, and so on. That would be a great public service, and maybe your work already as a group is surfacing some of those studies.
Oh yes, we've done that.
Oh my God, fantastic! Way ahead of me.
Yeah.
That is wonderful. Well, I will gladly.
Yeah.
That's wonderful. I'll circle back to you about that. So thank you so much, Dr. Jennifer Svahn. You are such an inspiring mom, physician, carer for your patients, your community, and your kids. And as a mom, I'm really inspired. And as a professional person, I'm really inspired. And I know there are parents and professional people across the country who will be, informed and inspired by what you had to say today. Thank you so much for your honesty and your expertise.
Enjoyed speaking with you. Thank you.
Dr. Svahn. Bye-bye.